everyone. Nice to see you. I'm Jim Falk, President of the World Affairs Council of Dallas-Fort Worth, and this is a continuation of our program, COVID Country Spotlight. And for those of you who have been watching them, and you can see them now on YouTube, we've already talked with friends and diplomats in Israel, Finland, Tunisia, and Taiwan. And today we have the pleasure of talking with the Consul General of Canada. She's based here in Dallas. Her name is Rachel McCormick. Rachel, thanks for joining us.
Thank you so much for having me, Jim.
So Rachel, you recently came to Dallas. I guess it was what, about 6 or 7 months ago. And before that, you were running the energy department for the embassy in Washington.
Yeah, exactly. No, and I think actually, well, first, thank you for having me today. And I believe you were actually the first person to welcome me to Dallas in a professional capacity. So I really appreciate everything that the World Affairs Council does here. And the really interesting work that you do, bringing people together to have really important conversations. So yeah, 5 years in Washington, D.C. Seems, and it was an interesting time to be there, of course, because governments changed in Canada and in the U.S. on both sides of the border then. Congress changed, and the energy and environment relationship for Canada and the U.S. is just so integrated and interesting, and we share lakes and water and birds and pipelines, and so every day was an exciting day in Washington.
And you've used some key words like links and integration, and right now, I guess really for the first time, that the border is closed, except for non-essential employees between, or non-essential people, between Canada and the United States. And I understand that recently the Prime Minister just a day or two ago extended that for another month. So with the proviso that he might extend it again. So how is that working? Who does get through, and is traffic flowing relatively easily?
You know, it's really, I think, a testament to how we have worked together during this whole crisis. That border is obviously the largest undefended border in the world. We trade $2 billion a day across that border. And right now, our stats compared to last year in terms of travel is about 95% down. So you think about getting to an agreement on doing that to keep our communities on both sides of the border safe, but also agreeing to what essential travel is so that we could get things going. Because all of our supply chains are so connected. Like I said, $2 billion of trade a day. And a lot of that trade relates to lifelines, energy, utilities, food security, medical supplies. So we needed to make sure that trucks and people that were providing those services would be able to get back and forth across the border easily.
And now that they're trying to get the automotive plants going, that becomes truly essential too, doesn't it?
Absolutely. And there's so many sectors where we're integrated, and we have the next stage in our modernized trade relationship coming up soon with the USMCA coming into play July 1st. And so we see a really great opportunity with that. We have always, in times of crisis, the need to sometimes think about the value of us trading with each other, and to have sometimes, difficult but really important conversations about protectionist tendencies that can happen. Sure. And how we can work together to make sure North America is strong and that our communities on both sides of the border are served well.
Well, the number of cases in Canada, while significant, certainly pales in comparison to the United States. I think you have about 80,000 cases and just a little over 6,000 deaths. How has testing gone in Canada? And I'm also interested in that, and how you've handled, or are you seeing a lot more cases, obviously in certain areas in the urban environments like we are here, and practically none, say, in Manitoba or some of the real rural areas?
Right. So I think that map there is a really good indication of how the differences exist. And we are happy to see that we are really planking the curve. As our Chief Medical Officer, Dr. Tam, has been talking about, we just had Canada's May long weekend last weekend. And so things are starting to open up, and the health officials were really recommending everybody to still be really thoughtful about how they're interacting with each other and to think carefully. So my home province of Saskatchewan, it's right in the middle there. Former premier used to say it's hard to say but easy to draw. So if you don't know your geography, it's the 1/3 from the left. And, you know, the capital has 1 active case right now. My hometown, Saskatoon, has 4 active cases, and the trend is going down very quickly. And just like in the United States, unfortunately, we've had some vulnerable communities that have been hit harder. And so of all the active cases in Saskatchewan, for example, a lot of those, over 85%, are actually in a northern community, which is heavily populated by First Nations. And those communities have been receiving extra support, both from a medical perspective, but also to make sure we help ensure that more cases aren't being brought in.
And if people aren't familiar with the term First Nation, that would be like Indigenous Canadians, similar to our Native Americans in this country, to a degree.
Exactly, exactly. And so, you know, great to see the numbers going down there as well, and not just in urban centers. Further to the east, you see those are some of the places where we had higher numbers. Obviously, also our most populated provinces. And unfortunately, there were a few hotspots in nursing homes and things like that, just like there have been here. But overall, I was just looking at a graph, and the new cases every day, we really are going downwards. And so that's very positive.
So as you reopen, are you reopening it in different phases and different colors the way we are in the United States?
So, you know, we have sort of gating, just like the United States does, with medical professionals giving very specific advice. Also, the provinces are, as always, our partners in managing this crisis, and also managing how we respond to the economy. And so different provinces are opening up a little bit more. Saskatchewan is opening up this week and last week. Some of the provinces out east haven't had a new case for a couple of weeks, and so they've been able to open quicker. And, you know, everybody's doing it a bit differently, but with those gates in terms of cases, of testing capacity, et cetera, being core to the conversation.
Have you had the horrendous unemployment as we have had in this country?
We have definitely had some important and significant impacts in terms of employment. And the government has taken a big step, a number of very big steps in terms of what they call their COVID economic response plan, which includes both fiscal and monetary measures to try and get the people taken care of, families taken care of, communities, and also businesses.
How long is that going through? Like, you know, ours, some of them are beginning to expire in July. How long are yours?
A number have been extended. So for example, we have the CERB, CERB, which is sort of a COVID specific unemployment benefit. And I have to tell you, the most amazing thing with that is the IT people that got it going. Really, it was like, it seemed like overnight that they had it up and running, and almost no kinks to the process, but it gives people $2,000 a month for up to 4 months at this point if their jobs was affected or they had to care for somebody that was being affected by COVID-19.
Relatively early, the Prime Minister's wife, Sophie, tested positive. And I suspect that was a way to really bring attention to it.
The Prime Minister has done daily briefings, as has Dr. Tam, our top medical official at the federal level, as have our ministers. It's been a very engaged conversation with the Canadian public. A lot of talk about the science and also the policies that we're putting in place to address the impacts and how to stop the spread. It's been a really extensive conversation. And so when Madame Trudeau was isolating herself, the Prime Minister was doing what a lot of Canadians and Americans were doing, which was being at home with 3 children, but it was the reality.
You know, I had the chance this morning, Rachel, to watch his press conference, the Prime Minister's press conference, and also saw the Minister of Health and so forth. Wanted exercised my French, which was good, but also just to see how the questions were posed, and it was very, very interesting. I encourage people to do that. I think it's taking place twice a week, typically, unless there's a special reason to have a press conference. You know, we're seeing a lot of discussion in this country about whether or not you should wear a mask. As I was out this morning, I could see some people were clearly wearing it and others were not. And are you having the same type of issue? And is the Prime Minister setting an example?
So I think it's interesting, obviously, it's been a conversation, and the science and the knowledge about the value of masks has evolved since the beginning of the crisis 10 weeks ago to now. And I think for health officials, in Canada, they've been very honest about the fact that the science and the knowledge is evolving. And so Dr. Tam has said now that like one of the frontline measures, that extra layer of precaution and care is a mask, and that it will help you stay safe to wear a mask. And the Prime Minister is now wearing a mask, and he said, you know, that's a personal choice that based on the science and the medical field, that he thinks for himself that's the best thing to do, and especially as he's interacting with Canadians. He's, you know, he said, like, when he gets to Parliament and he's sitting behind the desk for question period, he'll take it off when he's in his own sort of space, but he will wear it in public.
And I see that barbershops aren't open yet either. At least he hasn't gotten a haircut.
They're starting to open in some places across Canada, and you know, it's interesting how excited people get over that.
Tell me what is Canada's position on the World Health Organization, because certainly President Trump has been quite out front on cutting the funding.
Right. So Canada has come out very strongly in support of multilateral cooperation with respect to the World Health Organization. We have Canadians serving at very high levels at the World Health Organization, including for epidemiology research and crises. I see the value of international cooperation, not just on responses, but also on science. But I think it was really interesting, some of the conversations that we've had through our press briefings this week about the fact that this is a member-driven organization, and members make it strong as well. So contributions are important. One of the things that Canada signed on to is we're a member of the Global Research Collaboration for Infectious Disease Preparedness, which is always something that rolls off the tongue, right? But it ensures that all of these countries have committed to sharing what testing, research, innovation is happening, to try not to duplicate efforts. And so sharing results so that you can benefit from each other's trials and successes and see what's working, and use resources as efficiently as possible.
So what do you think has been the impact, or will be the impact, of the United States withdrawing to a fairly measurable degree from some of these multilateral organizations?
Well, in terms of the Canada-US relationship, I would say that we have significant and deep cooperation across the medical fields and on technology and innovation. So we look forward to continuing to work with the United States on those fields, and you know, hopefully work with them at the multilateral level as much as possible as well.
Let's talk about education for a moment. We're just beginning to see now in the United States universities stating what their plans are for the fall. Are you all in the same situation and just beginning to give people some ideas?
Yeah, and really interesting conversations about what the sort of secondary and tertiary impacts of that are. You know, when you think about people going for the first time to university, now they're not moving, so there's a real estate impact. There's obviously an impact on the service sector, on things like that, it's more than just classes, right? It changes the experience, and it changes how the economy works around an academic institution as well.
Although I don't think your universities revolve quite to the degree that ours do around football and other sports.
No, it's not quite the same. In fact, that's definitely on my cultural experience list for Texas, is going to some high school and college games. But
for U.S. universities, it really does have such a material impact on the school's finances. Another thing that I wanted to talk with you about is international students, because there's been discussion here about whether or not international students will even be permitted to come and whether they'll want to come. But Canada's been quite aggressive in being a good salesperson in trying to recruit a lot of students who perhaps for a variety of reasons are not coming to the United States. Do you see that continuing? And has Canada sort of given an open door to international students this coming fall?
So I think that there definitely is going to have to be a conversation for any students that already have a visa. They are welcome, and we are not taking our foot off the gas in terms of trying to be the destination of choice for skilled labor and global skills gaps. And we will sort out ways that we can deal with that. So for example, under the essential travel between Canada and the US, we have opportunities for seasonal workers to come in. They have to quarantine for 2 weeks, but we realize how important that labor is to the sector, especially in the summer. And so we've found ways to bring those people in, but be safe and keep our communities safe at the same time. So the government has programs with agriculture sectors and other sectors to help bring those workers in, but keep them safe.
Well, Rachel, I want to thank you. One, for your service as Consul General of Canada, not just in Texas, but how many states do you cover?
5 states, so the South Central United States.
Well, you're going to have to catch up on a lot of travel, but thanks for being with us, because I think our viewers find it very interesting, as do I, to see how countries throughout the world are facing and handling the pandemic, COVID-19.
Thank you so much for having me. Look forward to talking again.
Take care.